Today on the 01581, a conversation with our Representative Kate Donaghue. Hi, and welcome to this episode of the 01581 Let's Talk. I'm Shelby Marshall, I'm the host of this show. I proudly serve as a member of the Select Board. I do this for fun and an opportunity to bring people to you who I think you should know, folks that can provide you an update on what's going on, not only in Westboro but beyond, and we'll talk about that in just a minute, but also to keep you current on events in the town and things going on, particularly in town government. So today's episode, I'm honored to have our State Rep, Kate Donaghue. She's a stranger to no one here. Kate has been a longtime resident in Westboro and is now in her second term here in the state legislature, and I'm excited to have her on the show today. Kate, welcome.
Hi, thanks for having me.
Yeah. So would love to kind of take an approach today, and as we have time together, to look back a little bit and then to look forward, because I know now we're right in the sweet spot of new legislation. Legislation filing. So a little bit kind of as you look back on legislation that you were involved in, or just kind of your thoughts about the
Sure.
prior year.
Well, as a new rep, a lot of times people would say to me, how do you like being in the State House? And what I decided on, sort of my stock line, is I learn something new every day, and on a good day, I get to help someone. And you can do so much there, and there's so much opportunity to learn. As some people know, I lost my son, my only child, to an overdose, and I don't want to say it's my highest priority, but it's where my voice is strongest.
Sure.
Everybody at the State House, nobody can be involved in all 6,000 pieces of legislation, but I focused on substance use disorder, particularly around the issue of Narcan, among other things. So, and sometimes I share my son's stories. So I was very pleased that a piece of legislation that I filed directly, as well as a piece of legislation that I co-filed with Representative Vargas, both of these pieces of legislation were included in the substance use disorder bill that was signed into law on December 23rd. That was the official signing. And that was exciting to have that happen. One of the pieces of legislation, interestingly, before I even thought of running for rep, I was working with Rep Vargas on. And that now, once it goes into effect, it's been signed into law, will require rehab facilities to give people who are leaving 2 doses of Narcan or some other kind of opioid antagonist. I learned that it's important to write the laws so that it doesn't specify a specific medication, because if something else is developed, you don't want to have to change the law and have people giving medication that's not optimal or maybe more expensive because something new has been developed. So that was something we all learned about. And the other piece of legislation is very personal to me. It talks about studying administrative discharge from drug and alcohol rehab facilities. Administrative discharge is what happens when somebody is thrown out of a program for breaking a rule. So most of the families will tell you, their child might have been thrown out for literally showing the symptoms of the disease for which they're being treated. Maybe they used alcohol, maybe they used drugs. I've heard stories of people being thrown out for something as simple as wearing a hat where they weren't supposed to wear a hat. And it can have devastating effects. I told the story on the House floor when from the podium when we were debating the rule. I talked about one of several times when my son was thrown out of a program. In this particular case, he was thrown out of a program for smoking a cigarette, a regular tobacco cigarette. he was smoking in the restroom. He knew he wasn't supposed to be
Sure.
doing it,
Yep.
but it happened, and they threw him out. That put him in a downward spiral. He tried to spend the night in a hospital waiting room. He knew he wasn't supposed to be in this waiting room, but he, and he was with another young man, and they had drugs with them. They were arrested, and at that time he'd had other legal issues, and he was either going to go to be held for 5 weeks until the next court date, or we bailed him out. And we ended up bailing him out because we thought that would be best for him. And we were working on getting him into a program. By the time we got him out, it was late on a Friday afternoon, and he was spending the weekend with us. And I could just see him going further and further into depression. And I said, tomorrow morning we'll drive to Boston, we'll go to this place where they, help people get into programs. About 2 a.m. he woke me up and told me he just tried to kill himself. Ambulance to, Westboro was always great, ambulance to UMass.
Sure.
He spent the next 3 or 4 days in the ICU, and then he was on a psychiatric ward.
Yeah.
And then about 2 weeks later, he was admitted back to the same level, not the same program, but the same level of treatment that he'd been discharged from 2 weeks earlier. At the time I said, could there be a more compassionate and cost-effective way of dealing with a young man who smoked a cigarette?
Yep.
Now, as a legislature, I've been able to ask the same question.
Okay.
So the substance use disorder bill involves studying administrative discharge and to see if we can develop guidance that will help inform others.
Sure.
So if anyone out there has a story, either of your own or of sons or daughters, brothers or sisters who have been thrown out of a program for administrative discharge, you can contact my office. I want to hear these stories as this study moves forward.
Well, powerful, Kate. I don't want to say mic drop moment. There's really nothing to add, but I do. I guess I will add that I appreciate the approach of a study. Right. Let's understand kind of what's going on. I appreciate your recognition of, he was doing something he shouldn't have done. I also, as you were telling the story, I'm immediately going to ching, let alone the heartache, which has no price for yourself and your husband and your son, and that, what was it, 2 or 3 week gap there? 2 weeks. 2 weeks. Of this back and forth and ambulance and ICU, and I mean, it's not effective. So aside from the mental and physical anguish that you all went through.
When I first told the story, I was saying, could there be a more compassionate and cost-effective way?
Yep.
And then when talking with legislators, I sometimes shifted around. Could there be a more cost-effective?
Yeah, well,
and the human cost.
Yeah,
it's
absolutely,
very, very
absolutely.
real.
So,
and it's not as simple as you might think. Rep. Jim O'Day had filed legislation a number of years ago that would essentially mandate that somebody who's discharged for those kinds of reasons is offered treatment at a comparable or higher level. But it's hard to legislate beds into existence.
Right.
What if something's not available?
Sure.
And to say you can't throw them out, there are potential safety issues.
Yeah.
Smoking.
Sure.
It's hard to say in a bathroom that it was really a fire hazard.
Yeah.
But if people are saying, oh, it's not allowed, so they're smoking in bed.
Right. Yeah. I mean,
there are very real issues.
Yeah, very real issues. Again, and I think it's important for the public to understand that you've worked on many pieces of legislation beyond, kind of opioids and kind of mental health. And so that's a great segue here to looking ahead to the new year. And if you can just talk about some of the legislation you're supporting.
Sure. Well, I'll start with some of the legislation that I filed. Some of them are kind of technical things. The first one on my list has a Westboro connection, kind of, but it it establishes funds for the Massachusetts Division of Fisheries and Wildlife, so that money that's already coming in can go into a fund that directly connects with them. From a legislative, they're getting the money now, but it's very, there's a lot of workarounds they have to do.
Okay,
So this would make it.
Because if I looked confuzzled, as my daughter often says, that was it. Like, if they're already getting it, why do we have to file legislation? Streamline.
It streamlines.
Okay.
It streamlines things. And there's one that you as a select board member would be particularly interested in. It allows, I'm just looking for it on my
Take
notes.
your time. Just notice, how many pieces of legislation were filed?
I don't even know. It's usually over 6,000.
6,000. So give her a moment here to just kind of look through the long list.
But this would allow towns and cities to better enforce bylaws and ordinances.
Okay.
It increases the maximum amount that you can fine somebody or you can collect from somebody.
Oh, yes. Our town manager had mentioned, yes.
And that increases that up to 1,000. And very importantly, it allows the town to add the cost of collecting it.
Yes,
So that's something that is kind of in the weeds. This is a refile from last session.
Okay.
And the MMA is supporting it.
Okay.
So
Is this different than Christy had mentioned legislation potentially for new fees?
This is different.
This is different. Okay.
This is fines. So if
Fines,
somebody is dumping snow in wetlands,
Yep.
or violating animal safety laws,
Sure. Okay.
then it allows you to have higher fines and to
And enforce them and
enforce them.
Okay. All right.
So that's
great.
important.
Great.
Here's an example of $1,000 per violation. Collect associated fees and costs through the legal process.
Okay.
So right now it's kind of hard for, it's hard.
You got to expend the money to get the money, and
Especially with I think the current, I think it's capped right now at $300.
Yeah.
You can't
It's-
talk to your lawyer.
Right. Exactly. Yeah.
For less than $300. Here's one that's filed for the first time this session, and it was filed directly because a constituent reached out to me and said this is important,
Okay.
and that's the licensure of music therapists.
Okay.
I mentioned earlier that I learned something new every day. I learned a lot about music therapy, and I guess it's a very not well understood profession, and there's a national organization, and we're looking to be able to get them licensed, which would allow for people to go into private practice, would allow more for insurance reimbursement. But I learned that music therapy can be very effective.
Oh, absolutely.
So if you've got, like a child who's been through trauma, and they say you've got to go talk to your therapist. No.
Yeah.
Oh, you've got to talk to the music lady.
Yeah, exactly. And music therapy is used in hospice, palliative care as well.
Oh,
Yeah.
that's what they were explaining to me, that from very young people to, people, much older people.
We all probably need a little music therapy right now. I think that's what I've been doing. I've been doing less news therapy and more music therapy.
Well,
Unlicensed, of course.
Well, that was one of the things that she was trying to emphasize, is that without being licensed, it's not taken as seriously. And they talked about the value of people coming in and playing, somebody was telling me the story of this harpist who would come into their medical facility.
Yeah.
But that's very different from trained people. And it's using it like speech pathologists.
Sure,
And they can do comparable stuff, but with music.
Sure.
So it's very related to speech pathology as well as therapy, as
Right.
well as palliative care.
I remember, a little sidebar here, I remember learning about a program, at the time it was in Bolton, there may be similar programs here in Westboro, where they do animal therapy, like equine therapy. And it's fascinating, it was fascinating to hear the stories of how people who had experienced trauma, particularly younger people, but certainly not exclusive to that, to be able to engage with an animal and verbalize, their trauma in a way that they never could with another human being. And so I don't know if that's like licensed or whatever else. But it was, to me, it was unique at the time. This is many years ago. The Rotary Club had supported this particular program, and I thought, wow. I mean, I know what comfort my dogs bring to me on any day.
I talked about how I learned something new every day. I visited a farm right here in the 19th Worcester District that does animal, that hosts.
Okay.
They don't do the animal therapy, but that's the purpose.
Yep.
And it's interesting, the whole issue of farms. One of my colleagues, Senator Robin Kennedy, is visiting farms in every community that she represents.
Okay.
And she's the senator for Northborough, which I also represent. So I went out to the farm in Northborough, and I had never thought of it as a farm.
Yeah.
But so it's much more common.
Sure.
I guess there's a bigger one in Bolton,
Yeah.
and that's their business model.
It absolutely is very interesting model, very.
And
very
that was
interesting.
where they stressed the same thing that the music therapist talked about.
Yep.
Kids are much more willing to go into therapy if they're visiting
Yeah.
the dog lady or the horse
music lady,
or the,
right, exactly.
So,
Okay, all right.
yeah.
So music therapy is a licensed practice.
Yeah, and so, again, this does touch on some of the work that I've been doing with, this one is looking back at what I've accomplished this session. This past session is what I'm looking at filing. Early last year, I set out to see what it would take to get Narcan, I'm using Narcan for opioid antagonists, to get Narcan into the hands of everybody leaving a carceral facility, a corrections facility, a Department of Corrections facility, or a jail, a house of correction. And the first step was to try to find out what's happening right now. So in terms of the Department of Corrections, it was pretty easy to find out. They told me that if somebody was in one of their substance use programs prior to discharge, if somebody was on any kind of medication like Suboxone, we used to use it as MAT, now they're using MOUD. If anybody was on any kind of medication for substance use, then they would give them Narcan when they were released. But but if they were in the general population, they weren't unless somebody had identified them as being at risk. So I said, okay. As I explained to a lot of people right here in Westboro, when we hosted in conjunction with the Department of Public Health, we hosted a Narcan
Yes,
training.
I remember that. Yep.
Yeah, and 50 people came. But a lot of people don't realize, I learned that most people didn't know that Narcan is now like CPR. When Narcan was first available, we saw it as something you wanted to get into the hands of our first responders and people interacting with at-risk populations. Now we see it as something like CPR. We want as many members of the general population trained in CPR, and now we want members of the general population trained in using Narcan. It's not that hard. It's easier than CPR. Trained in using Narcan and carrying it. If I had my purse with me, I'd show you that I've got it with me all the time. I didn't think I'd need it right here in the studio. But it's so at the time I asked if I could meet with the appropriate people in the Department of Corrections to see what it would take to get this changed. And it always takes a while to set things up. By the time I got to the meeting, they said, "We're doing it."
Okay. Okay. Well,
And sometimes if you just ask a question, it can be something that pushes people over the edge. There. And so
in a good way.
In a good way. In a good way. So I'm sitting there with the ADC, which is the Assistant Deputy Commissioner, something like that, with the ADC and his team. And I'm saying, "So you're doing it?" And he says, "Yeah, and he says he acknowledges one of the other people in the room. She'd been pushing me to do it. And so we just decided. He says, I found the money and now we're doing it.
Okay.
And so originally I said, great, cross that one off the
Right.
list, done. But as I was sharing that story with one of my colleagues and talking about how much you can get done without actually having to do it legislatively,
Yep.
because it's by intention a slow process. She said, that's great that you got it done,
Yep.
but get it in legislation. She said, you never know when
Yeah.
a different commissioner or
Changes,
policy will change.
exactly,
The
sure.
funding might dry up.
Yep, yep.
And I said, okay.
Yeah.
So one of the pieces of legislation I filed is to get, to make it mandatory
Okay.
that, that we, that people leaving carceral facilities.
Now, as part of this particular piece of legislation, is there a study or statistic would present, to kind of look at the recidivism rate based on that, or does it not sort of go? Does something like this not have to go that, I don't want to say deep?
Well,
I don't want to say rubber stamp it, but
no, I mean, I thought you were going to go, how will it be paid for?
well, yeah, sort of that was my next question, but yes.
And so,
Well, and the two tie together, right? I mean, I think it's great in concept, right? My fiscally conservative side would say, but is it really needed?
well,
You know-
you talked about so many of these things that when you look at it, you will say, yeah, this, if there's recidivism, but this Narcan, I wouldn't say prevents recidivism. Narcan saves lives.
Okay. Yeah, fair point. Yep.
And,
And it may not benefit that person that's walking out there, but it could save a life of someone with whom they engage
or
with.
it could save their
Yeah.
own life.
Save their own life.
If they're, I actually, literally, most of the time, wear the Narcan around my neck. I have a lanyard with my keys, my ID, and the Narcan is taped to the back of my ID.
Oh, interesting.
So if
Oh.
somebody were wearing it visibly, it could save their own life. They
Yeah.
could be in a position where they're passed out
Yep.
and, about to die. And someone says, oh, he's got Narcan on his carabiner.
Yeah.
They sell it now.
Yeah,
I met with a
yeah.
couple of high school students on Sunday, and they have their medical club is focusing on Narcan
Oh, interesting.
this coming semester. And education, getting people more aware of it. And they started talking about how they were working with people who were designing containers where they could carry 2 doses. I only carry 1,
Yeah.
but carry 2 doses of Narcan right on a carabiner. So,
Okay. Do you anticipate, just going back to the training that you offered that was well received, was there funding around that to provide the training? And do you anticipate offering something like that in your kind of
well, one of the
jurisdiction?
One of the pieces of legislation that I co-filed, so there's a new legislator who is also a physician. And we need people from all sorts of backgrounds in the House of Representatives. And we had a physician for the first few months of last session, but he was tapped by Maura Healey to become the Secretary of Veterans Affairs. So now we're back to having a physician. And one of the bills that I co-filed with him is an act establishing a naloxone purchase trust fund. And this would, if I'm recalling correctly, utilize, I'm not just saying anything you don't know, but the drug manufacturers played a huge role in the whole opioid crisis.
Yeah.
But this would,
With the settlements?
I'm not exactly sure.
Okay.
I think that this would be more from profits they make
okay.
on an ongoing basis.
Okay, got it.
I have to,
Yeah,
as I
no.
said, just my one page.
Yeah,
but,
no, that's fine.
But it would
Yeah.
establish a trust fund, and I
Okay.
learned that there are, often when people are at hospitals, because prescriptions and reimbursement are designed for, I give you, whatever.
Yep.
insulin,
Yep.
and which is not prescription, but
Yeah.
but insurance covers the person who is receiving it.
Mm-hmm.
And since the naloxone is not designed to be given to the person who's getting it, if you see what I'm saying.
Oh, interesting. Yes.
It makes reimbursement.
Yes.
So
very interesting.
So.
Oh, I hadn't thought about that.
Yeah.
Interesting. Okay. Yep.
So this piece of legislation would establish a naloxone purchase trust fund, which would be administered by the executive office of HHS to expand the availability of opioid antagonists such as Narcan, in public places with a special focus on healthcare and carceral facilities.
Okay.
And to further touch on one of the things that I talked about earlier, one of the pieces of legislation that I filed was actually filed at the request of a national workplace safety organization that has looked at the statistics of the number of workplace deaths that are caused by overdoses.
Wow.
I don't want to talk about workplace, causes. There's so many other things that don't result in death, but a significant number of workplace deaths are opioid overdoses.
Wow.
So
It's a sobering moment.
it is. But I filed legislation that would mandate that state agencies and boards do have Narcan and train their employees annually in using it. And it would also provide guidance to private facilities. When I talk about this, people say, why don't you mandate it be in restaurants and bars?
Sure.
And we have a lot less control over restaurants and bars than we do over public places.
Yeah.
And so this is a first step in that area.
Yeah, although, you could, to that point, I mean, we have AED devices in those types of restaurants and bars and other,
Exactly.
why wouldn't this be available?
And EpiPens, things like that.
Yeah.
There are so many things that can save lives that
absolutely.
aren't that expensive or require that much training.
Interesting. Okay.
So that was one of the bills that I filed. Some of them are so nitty gritty that. Oh, here's a fun one. One of my young constituents from Southborough is really big on trying to protect the blue-spotted salamander.
Okay.
And so last session, she's been working on this for a while. And so even before I was elected, a couple of sessions ago, this had been filed, and she was looking to file it and learned that another group had already not file it, but work on it. But another group was already working on it. So she came in to testify, and
I love that.
Yeah.
All right, the blue-spotted salamander. Maybe
so
it's a new mascot. I don't know.
So that's interesting. And one of the pieces of legislation, and again, this was at the direct request of a constituent, but there was recently a lawsuit that there was a disabled person and a supporter, so child support.
Okay.
And it was first filed when the child was a minor, but by the time it went to be enforced, the child was no longer a minor.
Okay.
And this has to do with homestead protection.
Okay.
So you can have homestead protection to protect you against creditors, so you have a place to live. But there are exceptions for things like spousal support, alimony, and child support for a minor child.
Okay.
But the law specifically says minor child.
Okay.
And so the judge said, I can't go against this home. I don't know if it was a multi-million-dollar home, but I can't collect against this home, even though the child is in need, because the law specifically says minor child. And so the judge said, I don't think that was the intent.
Right, but it is the law.
It is the law.
Yeah. Okay.
So that
Interesting.
was
Okay.
it's
All
amazing the kind of things that you learn.
So Kate, in the couple minutes we have left, I guess I want to ask you, what are you, just sort of generally, what are you optimistic about?
Well,
Because we could spend a whole, we wouldn't have enough time, and that we'd put the guys in the control room to sleep. We could talk about the things we're worried about. What are you optimistic about?
I'm optimistic that people are well-intentioned. I'm optimistic that we're going to be able to get things done.
Mm-hmm.
And it's the more I work on this, the more I realize that even when people are in very bad situations, people will gather to help each other. We've seen that. I've seen that in so many different ways during the past legislative cycle.
Yeah.
I've met and learned from people in so many walks of life, and it's inspired me to be positive. You got to be. It's the only way you can get through life.
Right, you have to be, because if we, someone just shared with me recently, the only three things we can control are attitude, behavior, and our energy. That in terms of what we give and what we can control. So,
Attitude, behavior, energy.
yeah. So everything else is kind of happening around us, and how we approach everything. So you have a great attitude. Appreciate your perseverance. Appreciate your deep commitment, which is evident of listening to your constituents and hearing their concerns and finding ways to kind of move the pieces on the chessboard, so to speak.
Trying.
Yeah, absolutely.
Thank you so much.
Yeah, absolutely. And we'll have Kate back on our show as we near the spring, trying to kind of bring a rotation with Senator Moore, obviously, who you've seen on the show before, as well as Representative Hannah Kane. So I'm really excited that they are taking time out of their busy schedules to be here and bring their work and ideas and thoughts to all of you. So Kate, thank you so much.
You're welcome.